Hello, I'm Arthur Crofton on behalf of David and Associates, where all the latest advances in cosmetic dentistry can really change your life. But you don't have to take my word for it.
It's the perfect smile.
Wow. My daughter lives out of town now. The very first thing she said when she got off the plane the other day is, "Daddy, your smile looks fantastic." Nobody has ever told me that.
We virtually have every specialist in dentistry in the practice now. We can virtually do everything in modern dentistry under one roof.
Everything looks really good, clean.
I can't even describe how they feel. I mean, I just want to keep smiling. They look beautiful.
Wow, oh my God. That's great. I'm ready to go. Can I go now?
You're ready to go?
I have a social life to start.
And we have a program to start. Some of the people you have just seen have incredible stories of how a smile makeover from David and Associates has changed their lives. Their stories could be your story. All it takes is a visit to David and Associates.
In the next half hour, you'll meet Dr. Joel David and his in-house team of dentists and specialists. You'll learn about their total team approach to dentistry and why it's so important to you. And you'll see welcome technological advances designed to save you time and money.
What is amazing is that most of these smile makeover cases you're about to see can be done in less than 24 hours. If you come in by 9 a.m. one day, by 4 p.m. the next day, they will be inserting your case.
It's hard to believe, but in less than 24 hours, the laboratory of David and Associates, which has invested in the latest computer-assisted design and manufacture of no-grip veneers, all porcelain crowns and bridges, can give you a spectacular smile makeover in less than one day. This technology is perfect for time-constrained business executives.
There are many things that set David and Associates apart, including the fact that the stories of changed smiles and changed lives all take place right here under this one roof. Whatever your circumstances, it can all be handled right here by a skilled and experienced team. Now, let's begin our program with Chris's story.
Chris Simons is one of the high-profile leaders of Builders Care, a non-profit division of the Northeast Florida Builders Association. Its mission is to reduce substandard housing for low-income, elderly, and disabled residents of Jacksonville.
Thank you so much for everything here.
You're welcome, darling. We provide construction for seniors and disabled folks all over our city, and at no cost. And we use a lot of volunteers and a lot of the building community, a lot of the trades partners of the Builders Association, and I'm in front of people all the time trying to get them excited and fired up about the mission of helping people.
In the last 5 years, with the Lord's help, we've been able to renovate 600 houses.
But Chris had a problem. It was his smile. He went to see Dr. David about it.
He came in and he was really embarrassed about his smile.
I've always admired people with nice smiles, and I guess I have what you'd call a closed lip smile.
I've had bad teeth, particularly in the front, since I was 14 years old when I knocked my 2 front teeth out. Wow.
He had some old porcelain metal crowns, where with the old porcelain metal crowns, you used to get these dark lines at the gum. His teeth were really yellow. He had a lot of wear in his teeth.
It's been kind of a touchy subject with me because, you know, I've always wanted to have a nice smile.
This was a combination case of veneers and all porcelain crowns. So what we first did was a diagnostic wax up to show him what he could look like, and we also did cosmetic imaging or digital imaging.
The process was really quite simple because everybody that's involved is right here in the same office.
We do from the simplest filling to most difficult cosmetic reconstruction case. So we welcome you if you only have one filling, but we also have a lot of patients that come to us with very difficult dental needs. And because of this team approach, we can get them back to a healthy, beautiful smile.
The periodontist and the oral surgeon and the dentist, they were all here and available to look at my situation and come up with the best plan to get me a new smile. They made it quite simple. They showed me models and pictures of how it could be, and it made me quite hopeful what the outcome would be.
He okayed the wax up of how we were going to make a smile look.
This is absolutely amazing. I can't believe that you could take my ugly old snaggletooth and give me a beautiful smile like that. That's I can't believe it. I'm excited. I can't wait to do this.
We showed him the digital imaging, and then we prepared the teeth and sent it to the lab.
Now, 2 weeks later, Chris returns, this time to receive his new smile. His life is about to change.
Take a look at this and see what we've accomplished.
Wow! Unbelievable. I couldn't believe that I was seeing myself in the mirror and I had a nice smile, because I've never had that before.
You have a really nice smile line. We're seeing teeth
Nobody's
now.
ever told me that I've got a nice smile.
Excellent. I'm very pleased.
I feel much better about myself, better self-esteem.
They really look fantastic.
I think more than anything, it's given me a fresh start, a youthfulness that I haven't had in a long time.
Welcome to the 78th Builders Care Third Saturday Workday. Let's give the Lord a big hand clap.
When you're talking to groups of people, you know, you just feel more energetic and more enthusiastic, and people smile back at you.
So, would Chris recommend this procedure, this smile makeover from David and Associates?
Not only would I recommend Dr. David and Associates, I think my smile will recommend them from now on. Everywhere I go, people are going to see my smile, and people ask me, you know, what's different about you? And I said, well, Dr. David and Associates really changed my life, and I just never can say thank you enough for what Dr. David has done for me.
David and Associates is a multifaceted practice that emphasizes a total team approach. The team consists of aesthetically oriented dentists and specialists, and it's time for you to get to know them.
I'm really fortunate that, you know, my job is my avocation.
Dr. Joel David started his practice in 1987. He is passionate about dentistry, his team, and the patients they help.
The last 10 years has been unbelievable with implants, porcelain crowns, veneers, bonding systems. So it's very exciting to be able to offer patients, you know, what we can offer them now that we couldn't offer 10 years ago. And by having all the specialists in the practice and the cosmetic dentists in the practice, we just have a lot of patients that come in and you know, they say, God, we've never seen a practice like this before.
One of the things that I do mostly is cosmetic reconstruction, or dealing with improvements to the way people's smiles look.
This is Dr. Brack Phillips.
Nowadays it's not so difficult for us in a modern practice with the proper training and a good team to tackle these issues. We can definitely accomplish almost anything that our patients need. In a private practice, in another setting, you might have to refer out to another practice to have some surgical procedures done or periodontal procedures. But as us all together, it's all under one roof, and I can communicate with my specialists because they're my friends, and we work together and get these cases done for our patients.
Let's take a look at how another life was changed thanks to the team at David and Associates.
Well, this is a nice combination case where a patient, her chief concern was not really pain or dysfunction, but she wanted to enhance the way her smile looked. We've got lots of ways to do that, so we can kind of tailor that to what our patients need. Her particular concerns were she had a gummy smile. She didn't really like showing all this gingiva up here when she has a nice big smile. So one of the things we do as a team here at Joel David and Associates, our periodontist was able to sculpt the gum tissue away from the smile line where it's visible, and then I as a cosmetic dentist go back with a combination of crowns or veneers in porcelain and give her that beautiful smile that she's looking for. So no matter how happy she gets, all she's going to show is beautiful, youthful, healthy looking teeth. It's always a challenge, that's for sure. Every patient's needs are individual. What people are looking for sometimes are easy to accomplish, and they didn't know that it was easy, and they're very happy to find out that we can do what we can do, and in a quick step of time, have them smiling with more confidence, being healthy, happy.
Now, something you don't usually see. The dentist becomes the patient. Dr. Phillips is getting a smile makeover with something you're going to love, Lumineers.
We do a smile makeover with Lumineers. What we're going to show is all we literally need to do is take a couple sets of impressions, some photos, and we're going to ship those to the laboratory, and in about 2 weeks you're going to come back and we're going to have your smile makeover done.
If you don't like shots and you don't like pain, you will like Lumineers.
It's such a paradigm shift from not having to give somebody an injection or a series of injections and no temporaries to worry about. So, you know, it's really, you're going to be able to show your own patients how we've been able to do a smile makeover, and it's totally painless. So it's kind of exciting.
Dr. Phillips, the patient, expects his new smile to be a confidence booster.
It's finally going to be for me. I am in the field of dentistry. When I smile, there's not anything particularly attractive about my smile. I would consider it average. I think that I should have the best looking smile that I can, and this is going to give me that. I've dated some people who are in the field of dentistry who have beautiful smiles, and I've always wished that mine looked as good as theirs. And dental hygienists in particular, usually they have pretty teeth, and it's just something I've always been kind of embarrassed about. I don't want to have to hold me back anymore.
In about an hour and a half from now, you're going to have a beautiful smile.
The wax model shows how his teeth are going to look. Dr. David begins to make it all happen, and when he's done, the mirror tells the story.
Wow, oh my God, that's great. Basically, we're taking what I already had, putting the porcelain veneer over that to enhance what was there, and hide some of the things that I didn't like, the shortness, the discoloration of the teeth. Those things are no longer a problem, and I've got the smile that I wanted. I'm excited, this is great. I'm gonna have to learn to show it off a little bit more. I've been always kind of low-key with the smile, but I'm gonna get the megawatts out. And it feels natural. Yeah. I mean, I'm ready to go. Can I go now?
You're ready to go?
I have a social life to start.
And while we're talking about lumineers and smile makeovers, let's meet Susie Jones.
I'm a chicken. I don't like the needle, even though I am a dental assistant. I just don't like pain.
She's been my main assistant when I do cosmetic cases for a number of years.
I have seen him do case after case and thought, I want that smile.
Just like Dr. Phillips, she didn't want her teeth ground down, so she'd been wanting to do a smile makeover.
And knowing that I didn't have to have a shot, no temporaries, virtually no prep involved, I could have a great smile in 2 appointments.
Susie's old smile had eroded her self-confidence, something she expects her new smile with lumineers to restore.
What's so incredible about lumineers is that they're literally the thickness of a contact lens. There's no veneer system in the world that's been able to ever do this. Are you ready?
I'm more than ready.
Well, let's get in the chair.
Okay.
If you'll give me about an hour, you're going to have a beautiful smile.
I'm ready.
When the hour is up and Susie peers into that mirror for her very first look at her new smile,
Wow. Oh my gosh.
she can't believe it.
They look fabulous. Oh my gosh, they are so pretty.
We took 2 impressions, about 4 or 5 photographs, sent it to the Lumineers laboratory. Basically 2 weeks later, in 1 hour, we did a total smile makeover with no injections, no pain. She loves it.
I can't believe it. I look younger. I really do. I told you that. Gosh, what a difference.
Based on that, you can guess she would recommend it.
Oh, absolutely. It was the easiest procedure I have ever had done. Painless, no shots. Sat back in the chair, fell asleep, and opened up to a beautiful smile. I'm just so excited.
It's exciting. It's rewarding to know you can help somebody out like that.
This is Dr. Frank Gupton, another member of Dr. David's team.
So you're actually helping somebody else out versus, just doing a job to get through the day. I've had people come in who could not get a job because their teeth were so embarrassingly bad they didn't want to smile for anybody or have anybody look at them. And you go in there and do some work, and all of a sudden they look in the mirror and they see that, yes, they have a pretty smile again. They can actually see tears come up in their eyes.
Let's take a look at how another life has been changed by the team at David & Associates.
This particular case had pre-existing crowns on the front teeth. As you can see, it has some bone loss between the front 2 teeth here and some staining, as well as you can see a lot of the gum on the smile. What we did in this case, a periodontist came along and removed, first thing they did was remove the gum tissue, so you got the gum tissue above the smile line. Then we went in and replaced all the pre-existing crowns to give her a new smile line and make everything look more uniform and correct the discrepancies of the staining and the bone loss in the teeth.
The old crowns were porcelain-fused metal crowns. What about the new ones?
These old crowns are all made of porcelain with no metal in it whatsoever.
The total team approach can also lead to the discovery of hidden problems.
That happens all the time, especially with periodontal disease, because it's usually totally painless in the first stages of the disease. So when we do a comprehensive exam, we'll find out a lot of times that this patient had no idea they had a problem.
As the team periodontist, it is my responsibility to evaluate the health of the foundation of the supporting tissues. None of these makeovers could be possible without having a healthy foundation. Periodontal disease is an infection of the gum and bone tissue in which bacteria get below the gum, whether from neglect or years of smoking. They cause pockets around the teeth, and then we start to lose bone. So here's a patient who had some bone loss that what we did is we cleaned out the area and regenerated all the bone back, about maybe 90% of the way back up.
In addition to being the team periodontist, Dr. Andrew Forrest is also the team implant surgeon.
My job is to stop pain, heal disease, and create new smiles. It doesn't get much better than that. It's nice to be able to have 7 specialists from different disciplines to work together towards a common goal, number 1 being the patient and, of course, the smile. What one specialist might not see, another might. So our lunch hours are consumed with x-rays, models, and cases. It's part of what we do.
taking on difficult cases and changing lives is also part of what they do.
This was a young lady who I met a year after an automobile accident. She lost all of her teeth and none of them could be saved. So her family, who I met with, told me that she'd become completely detached and no self-esteem. So we decided to do a complete smile design and makeover. And this started with doing a CT scan, which allows us to see three-dimensionally in the jaw and to precisely plan exactly where we wanted to place dental implants for a natural result. So once we did the bottom jaw as well, we completed the case. She did get several dental implants that took about 6 weeks to heal, and the case was completely done at 3 months. This was our overall result, and I can't have asked for a better result.
Look at that face and that smile. Look at the before and after.
Truly makes your job rewarding.
Other cases may be less dramatic, but they are no less rewarding for the patient or the team.
Here's a young lady in her early 50s who had been self-conscious about her smile for years and finally made the decision to go ahead through it. So she didn't like the gummy smile, and she had some old crowns that we were going to replace with all the metal-free restorations. So the first thing I had to do was kind of re-sculpt the jawbone a little bit to give the gum tissue a more harmonious, natural appearance. Then Dr. Alberto, our prosthodontist, came through and finished the case with a set of beautiful lumineers. The whole case took about 6 weeks from start to finish and got a result that was truly what we hoped for.
What I do here is basically focus on the replacement of missing teeth.
Dr. Juan Alberto is the team prosthodontist at David & Associates. But what is a prosthodontist?
I always get asked that question, what is a prosthodontist? It's one of these specialties that nobody knows what it is. Prosthodontists, we go to school an extra 3 years, get trained in a hospital setting to deal with the most complex situations that somebody could have in their mouth. Not only complex, but aesthetics, implants, and extensive trainings on the materials, on the latest materials that we could use. So basically, I do what a lot of other dentists don't want to do.
Dr. Alberto is among the 4 certified specialists and 3 general dentists on staff at the Jacksonville offices of David & Associates.
This is actually a police officer, and in the line of duty, lost his 3 front teeth. And what we did is we gave him some implants and restored his 2 front teeth. Actually put a crown on this other one, but actually got him to full restoration after him losing such, true front teeth, which are absolutely paramount in somebody's smile. This is a perfect example of an accident gone wrong and a resolution.
And it's the result of teamwork and collaboration by a group that works in one facility that achieves the best results for their patients.
The team approach is, it's kind of like, there's a saying out there, a dentist on an island. A dentist that has a practice by himself doesn't have too many people to bounce ideas off. So here, all I got to do is walk over to the next room and get the opinion of one of my other colleagues.
This team approach enables shorter treatment times while affording maximum consultation time between specialists and dentists to ensure the best possible treatment for clients.
These are old crowns. How you can tell an old crown is they have metal margins. That was before, when we didn't have the technology we have nowadays. We have all these new materials that we have that we can do metal-free crowns. You don't get these metal showings, and not only that, this patient also had what we call a gummy smile. So patient goes to Dr. Forrest, he does some plastic surgery, the gums around here, eliminates all this, basically makes the tooth a little longer, and then comes back to myself or one of the other doctors, and we put crowns across the front or veneers. And look at the difference in the smile, not only the gummy smile, but look at those crowns. That looks 100 times more natural than this does.
The highly skilled team at David & Associates combines technological capabilities and years of experience to work together for their clients on cases that range from routine to seemingly hopeless.
At David & Associates, we see a lot of forms of sports injuries and dental trauma. This is a professional athlete who lost his 3 front teeth, and the 3 teeth had to be very carefully and gently removed. We then placed 3 dental implants under IV sedation, and then had the case restored by Dr. Alberto, our prosthodontist, and put 3 implant crowns. Hopefully now I'll get him to wear his mouth guard.
David & Associates is also pleased to offer their patients specialists in the fields of orthodontics and pediatric dentistry.
We've actually got a whole separate wing of the practice with a pediatric specialist. She loves working on patients. She's very gentle. We have special days just for kids. We have all the toys out. We have TVs and DVDs. So we're really trying to make this a relaxing environment so we have the right situation for your child.
Well, a pediatric dentist is specially trained to go ahead and handle children. We spend 2 years after dental school actually getting training in a certified program in order to be able to treat children. And it's not just being able to handle the dental work that you have for children, but also children with developmental problems, with, difficult medical problems, children, autistic children, any kind of special needs. We are actually trained to handle them.
And as for your child's first dental checkup?
At the latest, we'd like to see the child by the age of 1. We like to make sure that we get the children in before they have the full complement of the baby teeth. We want to make sure we go over the infant care with the parents, that they're aware at one point it's appropriate to go ahead and use toothpaste. We don't want the younger children to have the toothpaste too early since they're not able to spit it out. It can cause them problems. We really want to make sure that the children come to see us before they develop any early childhood caries with the front teeth from breastfeeding or bottle feeding for too long. So definitely by the age of 1, we would like to have them in to be seen.
You start off with our pediatric specialist. Then what's happening is we're watching the growth development of your child. We have the pediatric specialist and the orthodontist both monitoring your child.
The orthodontics department at David & Associates offers technologically advanced comprehensive treatment for adults and children, including the latest in braces.
What a lot of children, actually what a lot of adults don't like about braces is that they don't like the way it looks. So what we do here is that, when we do porcelain braces, we charge the same fee as metal braces. There's no extra cost. We also do many Invisalign cases. So for the last 3 or 4 years, you can actually use almost undetectable aligners instead of braces.
Invisalign is a removable appliance. It's clear, so you don't see it when it's on your teeth. We have Invisalign for some cases, and if that's not available for them, then we also have porcelain braces. So that typical metal tin grin that you have is no more.
Dr. Carrie Maris is the orthodontic specialist at David & Associates.
Well, the American Association of Orthodontists suggests that every child should be seen by an orthodontist by age 7. At that point in time, you probably have your first molars and the 4 front incisors.
What Dr. Maris likes most is seeing how changing a smile can change a life for children and adults.
As an orthodontist, the best part is seeing someone come in who is self-conscious about their teeth, doesn't really want to smile, and you look at them and you know that you can change that. You put the braces on, or the Invisalign, or the interceptive treatment, and they come back and the problem is corrected and the smile is as wide as you could possibly imagine. If you or your child has a concern like that, say they're shy or don't really want to smile, come, have a consultation, see what can be done, see what things could be changed, because it could make the difference in their personality and how they present themselves to the world.
Dentistry just isn't what it used to be. And that includes not only braces, but bridges and dentures. At David & Associates, the old has given way to the new. Swiss dent dentures, implant-supported dentures, and more. Plus new techniques that make them better and more affordable, like all on 4 implants.
This patient presented with an upper denture. His main problem was with a typical upper denture, this whole area would be covered with plastic. So for many patients, this causes a gag reflex where they literally can't wear an upper denture. Now, traditionally when we did fixed restorations with implants, it required between 6 and 10 implants. Now with this new technique, we can actually do fixed restorations with just 4 implants. We have a very affordable way now to give somebody fixed teeth that have been wearing a removable denture. And in dentistry, nothing beats fixed teeth. And that's what this case is showing. So what we did is he had an old denture that he was having gagging problems with. In a period of a little over 2 months, we were able to place the implants, go to a fixed restoration with no plastic on the roof of his mouth, and this chews just as well as natural teeth.
When David & Associates does implant retained dentures, they offer the tightest attachments anywhere for removable dentures. It's called the locator.
And it's extremely tight. You can eat ribs, corn on the cob. This is a model that shows you how the upper restoration can be, and you can see that it's almost impossible to get out. So this is our second main way that if somebody comes in with a denture and they're having a hard time eating, the bone is going away, this is a very affordable way where we can retain custom Swiss dent dentures, plug them into the implants, and you can eat virtually any food you'd like to eat.
Dr. Joel David likes a challenge, and he really had one with this next case.
This patient was complaining that she couldn't wear a lower denture. Now, the hardest thing in dentistry to make someone is a lower denture, because with a lower denture, no matter how well it's made, they almost never fit well. And the reason for that is the anatomy of the lower arch. There's almost never any bone, and you never get suction with a lower denture. So in this case, what we did is we solved the problem. We placed 4 implants. With the new generation of implants, we only waited 6 weeks before we were able to take this restoration and plug it into the locators. And we can make this restoration where it's almost impossible to get it out because it fits so tight. This, again, is our most affordable way of solving. When a patient comes in and they're telling us they have no retention with a lower denture, they can't chew, we can take this and in a matter of maybe a little over 6 weeks have them a restoration where it totally changes their life.
Thank you for calling David & Associates. This is Sandra. May I help you? Sure, I can help you with that.
Everybody at David & Associates is there to help you. Whether it's the receptionist taking your call, or the dentist, or the specialists, they love what they do. And Dr. Joel David is at the head of the line.
I love doing implant dentistry. And you know, what's really nice about implant dentistry is to have somebody that hasn't chewed well literally for decades.
And I'm able to eat a sandwich now. Before I couldn't eat a sandwich, I had to pull it apart and eat it.
And in a period of maybe 2 months to change their lives, because they can go from basically having to cut the corn off on a corn cob to where they can go and eat a steak, and they're coming back and telling you how excited they are. You know, you can't get any more rewarding feel than that.
I love seeing a child come in who's been in pain, who can't eat, who's just not wanting to smile, and being able to change that for them and provide them with a wonderful, healthy smile, and their whole attitude changes. And they love to come in, they love to see us, and that makes me feel wonderful.
Well, it's wonderful to be able to work in an office where there's a pediatric dentist as well as other specialties, because it's easy to consult with that doctor right there, right at that time.
It is pure job satisfaction. It helps me get out of bed in the morning, and it makes my days going home a lot easier.
It's an absolute pleasure to work with Dr. David and the whole staff. I wouldn't want to work anywhere else, to be honest with you.
And with this team approach, if it takes periodontal surgery, implants, you know, porcelain crowns, whatever it takes, we offer in this practice. And it might take us 3 or 4 months or 5 months to get a patient back in a healthy state. But, you know, with the size of the practice now and the quality of the people we have in the practice, we can, you know, whatever it takes, get you back to a healthy smile.
What do you do when you're happy? You smile. If you can't smile and have that confidence to smile, are you really going to be happy? We all want to be happy, and we can help people just do that extra little thing that you might not be thinking about, but everybody wants to smile and look happy when they're doing it. And getting someone that confidence to do it, it makes me feel great. And our patients love it. It's a nice thing to do every day.
Well, as we have just seen, the total team approach to a smile makeover can really change your life. Cosmetic dentistry isn't just for movie stars anymore. With the advances in new techniques, you can get a smile makeover from David & Associates with minimum changes to your natural teeth.
For some great information on that, as well as other procedures and extensive education, visit the website of David & Associates at drjoeldavid.com. That's drjoeldavid.com.
On behalf of David & Associates, I'm Arthur Crofton. Thanks for watching.